Hi, this is Arielle Live TV, every Thursday from 12 p.m. to 1 p.m. And we have a lot of viewers around the globe, and I would like to shout them out later on before I'm going to introduce my guest today who is running for governor here in Nevada. But anyway, I want to welcome Dr. Fred Conquest, and we're going to talk about his platform, why he is running. And welcome to my studio, Arielle Live TV.
Yeah,
So
hi.
how are you today?
Great.
You look terrific today.
Thank you, Arielle, and thank you for having me on your show.
Let me ask you, as we talked earlier, you said you didn't grow up here. So where did you grow up?
Okay, I was born in Los Angeles, and I grew up in Gardena, California. I went to high school there. I graduated from UCLA a long time ago, and I got a master's degree at the University of Arizona in anthropology. My degree at UCLA was in U.S. history, and I went to England and got a PhD in anthropology. I spent roughly 30 years in the business world, mostly dealing with Wall Street, and I got a second PhD in business administration. After learning a lot about how to run a company. I was a CEO of a public company for 4 years. I basically retired, moved to Las Vegas, and went to teaching because that's what I wanted to do when I got out of graduate school. But at the time I got out, the only way you got a job in anthropology, somebody had to die.
Oh, that's sad. But anyway, why we've been talking about this. Why being a governor? Tell me. Let me go ahead and read what's your platform here and why governor. Okay, so as you said here in your website, it's time to build a better future for all the citizens of Nevada. Together we can secure our future, make Nevada a better place to live, and accomplish great things for everyone. And as you said here, if you become a governor, you support and defend the Constitution of the United States of America here in Nevada. And one of your platform will be reduce taxes, fees. Maybe you can discuss what kind of fees, because it doesn't specify in here what kind of fees are you trying to say. And of course, burdensome, wasting regulation. I don't know what kind of regulation is that. Maybe you can discuss that also to me. And of course, you said you want to create the business. The government of Nevada already create the business. Raiders is coming, and I believe the mayor of North Las Vegas, John Lee, also created the business. And also here, investment and improve the healthcare and education infrastructure throughout Nevada. So, and of course, ensure free, honest, and open election regardless whatever is going to happen. So tell me, why governor and why this platform? I know we have a lot of issues that we had to discuss.
Okay, well, one of the reasons is the governor is supposed to be the leader of the state, and the governor probably needs a vision of how things can be better and why things are the way they are, what works and what doesn't work. And being governor essentially means you should have some knowledge of what's going on throughout the state in all of the aspects of government, so you can help create policies that are not detrimental to the citizens but benefit them and help them become more prosperous, have higher wages, have better education and health care. And this takes leadership and political will to change things. Most of the people running for governor today, they're part of the good old boy network who simply just want things to stay the same because they're doing well, the good old boys are doing well, but the average citizen in Nevada is really having a hard time financially, and their kids are not getting the education that we're paying for, and healthcare, access to healthcare is a serious problem. Also, with the building of all of the new apartment buildings and upscale housing, there's no way for the vast majority of people in Nevada, based on the wages they make, to even rent one of these things. So the problems down the road are going to be an increase in homelessness, which almost always includes an increase in mental health problems and drug addiction as people try to escape them.
Let's break it down one by one. Do you
Okay.
think so Governor Sandoval is not doing his job being a governor of Nevada?
Well, he's doing a job, but it's not a very good job. He doesn't want to get into fights with people. He's simply a caretaker for the casinos and the lawyers and the so-called elite people who run the state. Whenever something comes up that benefits the citizens, for the most part, he doesn't.
So you're
Fight it.
trying to tell me that Governor Sandoval are only focusing on the high end,
Yes.
high end political.
Right.
He's not looking after the lower end, like the community, the young generation,
Right.
the poor, the small businesses. So you're saying that he's more focused on the high end corporation, big
Right.
businesses in Nevada.
Right, and in the long run, we need to educate our children much better, because they're the people that are going to run the show down the road.
Correct.
And we need health care, because if we have citizens who are sick and getting sicker, and they're getting older too, we're going to need to spend more money to on health care. And there's no real push for prevention. There's no push for healthcare
So
education.
the health care that Obama already designed, do you think so that's not enough yet? Because Trump also is trying to say the health care. So what do you think that need to be changed?
Okay, healthcare is a tricky issue. Part of Obamacare has some viable sections to it, but the vast majority was written by lobbyists, and most of it hasn't even gone into effect yet. And when it does, it's going to be a total, complete disaster for healthcare. We need to reorganize healthcare in Nevada. How we're going to do it, that's the simple or the more difficult question. We can have a single payer system, and it doesn't have to be the state doing it. We can structure a healthcare system to solve some of these problems, but we have to sit down and talk about it, and we have to come up with ideas. And that would be one of my main platforms, is get people from the insurance business, the doctors, the patients, the pharmacies, get everybody in the room, and let's find out how we can put together a viable healthcare system where everyone in Nevada can access it without too much problems and at an affordable rate.
I'm sorry, everybody already accessing the health care, and there's also a affordable rate right now. What are you trying to say, and what rate are you trying to deliver? What are you looking for? A better health care.
Okay, in Nevada, going to a primary care physician, people can do that. But in the rural Nevada, that's a hard thing, because some people have to drive 30, 40 miles to get to a doctor. On the other hand, if you have to go see a specialist, I mean, it's like 30, 60, 90 days before you can even get an appointment.
So you're trying to say then that you better recruit more doctors and nurses to get easy access to all the needies. Is that what you're trying to
Yes.
say, or
We need
not to lower the healthcare bill, or
No.
are you looking for more sustainable medical doctors, specialists, for these people to access it easy and not to wait for such a long time, to 90 days to
Right.
30 days? It takes like only supposed to be a day or the next day.
Right.
Correct?
We need more doctors, we need more nurses, and we need either a health care program or a health insurance program that doesn't have deductibles plus premiums, which essentially will bankrupt people if they have to meet the deductible. Because
Hold on to your thoughts. We'll be right back on the second segment. We will going to be talking more about his platform. Thank you.